Okay, I think we have 25 participants in the room. Just to repeat for those who might join afterwards. You are now in the Health Research Center breakout room number 1. And my name is Rolanda Julius. I'm based at the DSA Africa Coordinating Center. I'm going to call on our first presenter, which is Jacob. Jacob is from the National Institute for Biomedical Research. Jacob, if you could maybe just check if your slide sharing will work, then we could get started.
Hello everyone.
Hi Jacob,
Please,
yes, I can hear you.
please, can you see my presentation?
I
Did you
can
see my
see.
presentation? Yes.
Yes.
All right. Okay. Thank you. I'm Jacob Liaki. I'm a modeler in National Institute of Biomedical Research in DRC. And I'm happy to tell you about INRB and data science in INRB. So we can start. I can present you. I can tell you about house. Wait, oh la la. Okay, thanks now. Okay.
Jacob, you can turn on your video if you'd like to do that. It's
right.
your choice.
Okay, now it's okay?
Yes, it's okay. Thanks.
Okay, thank you. As I said, National INRB is founded at 1984, and it serves as a National Biomedical Research Laboratory for the GRC Ministries of Health, and is directed by Professor Gigi Muyembe Tanfum. The INRB his decades of collective experience in the identification, treatment, and prevention of disease in the GRCs. And since 2018, the INRB becomes WHO collaborating centers. About our lab, in INRB, we have several labs. All are dedicated in public health issues. We can cite bacteriology labs, virology lab, clinical biology lab, pathology lab, parasitology, medical entomology, and epidemiology and pathogen genomic labs. So we have also two centers like as Animal Research Center and data center, which help us to store all of that that is collected by at INRB. So about data science in INRB, INRB is involved on several team of work in several team of studies. All is implicated in public health issues. About data science, we can say that in INRB, we do the data collection and cleaning. We do also exploratory data analysis, statistical data analysis. In case of the team of bioinformatics, and we have also now machine learning and modeling that is implemented at INRB. But if I can talk about modeling, and INRB, we have one of studies is involved in the field of nutrition and its consequence on the occurrence of cancer using modeling and machine learning tools. About this study, I can say that about this study, we want to assess how can we predict the occurrence of cancer on basis of food and water insecurity. And machine learning help us to handle all of issue all of issue can help us to predict causal occurrence in households. So if I can tell more about data science, about the data center, we can see our data center, please, have a capacity of almost 150 terabytes. About opportunities at high energy, I can say that DRC is one of countries where more emergent and endemic diseases occur, and INRI is the one better of non-academic institutes which work on public health issues, and he is able to conduct a study in terms of data science fields. In terms of opportunity, we are able to generate up to 100 gigabytes of genomic data that can help us to establish biomolecular surveillance using geospatial or other type of data science models. Much of the work currently carried out, much of the work currently carried out at INRB require a data science perspective due to its geographical spread and balanced distributions of data density and other similar problems. This makes INRB one of the hub for collaboration between different institutions and applied public health projects in the DRC. So, what is our expectation about this meeting? We expect that we can build a collaboration with data science structures that can help us to build a capacity of our teams implicated in data science issues, and we hope as we can also build a collaboration with the institution that we can help us to improve our capacity of communication with the national endemic pathogen control programs. And also we would like to set up a collaboration framework with other institution experiences in data science in Africa and around the world. That is all of I have for today, and thank you, Rolanda. This is our contact. If you want to know more about us, you can send an email in this contact. Thank you.
Thank you so much, Jacob. The floor is open now for questions. And as I've mentioned in the chat, you are most welcome to post your questions in the chat, but you can also raise your hand and ask your question for Jacob. All right, so there's a first one from Daniel. Can you share the addresses in the chat? I can also post your website.
There's a hand up.
Sure. That's from Bennett. Sure, please go ahead. You can ask your question.
Hello. Yeah. Thanks for your nice presentation. What I want to ask is that I think this institute involved in many kinds of research activities. What I have seen from your presentation is that of the environment. The environment is also concerned. So, and there are also animal researchers. So as far as data science deals with kind of secondary data, how do you from where do you get historical as well as current data? We know that there are websites like Worldometers, which we can access the historic as well as the current data. Whereas when it comes to the animal health or zoonosis, because there is an interlink between, there is an interplay between the environment, animal, and and human. So where do you access? Is there any kind of repository data that we can all find to conduct research to understand well about the One Health situation? Over to you.
Okay, thanks for I think Mr. Bainet. And okay, I hear your question about repository of zoonotics issues in DRC. We have the Department of Epidemiologics and Genomic Pathogens that can help you to contact this kind of data, and the virology departments can help you also to contact this data. So the animal center research help us to build up to build or to make different issues about animal models issues that is the kind. This is specific to biologics, but if you want to experiment something or some I don't know how to say sushi in English, in animals, you can contact the Animal Research Center. So if you want the data about zoonotics issues in DRC, you can contact epidemiologics and pathogen genomics lab and virology. Those lab can help you to contract data for the study of interest. Hello, Mr. Bennett. I think you understand what you are saying.
Thanks, Jacob. I don't know, Bennett, do you have a follow-up question? All right, we have another hand from Michelle. Michelle, please go ahead.
Thanks so much. So Jacob, you had some expectations in your slides. You wanting to connect. Could you maybe go back to that? You wanted to connect with other pathogen labs, or what was that? Collaborate to improve both effective communication with national endemic pathogen control programs. So when you say national, you are in the DRC, right? Where are you based?
Yes, I'm here. Okay.
You in the DRC?
I didn't understand your question. Please, can you repeat?
I'm saying you in your expectation slide here, you say you want to collaborate or work with national endemic pathogen control programs. Is that within your country?
Yes.
Okay, so with your Ministry of Health, do they link to any kind of Africa CDC node? Is there any connection there with the Africa CDC?
Yes, at NRB we have a connection with Africa CDC. So if I tell you we want to build a collaboration with in terms of communication, it's about data science applications on our system of surveillance and control and prevention of disease.
Okay, because then, so if it's around surveillance, then maybe a good connection from our side would be those folks working on surveillance. And I know of at least one program, the Inform program. And I mean, in my presentation, I spoke about our the chairperson of our organization is involved in that program, and they work on surveillance around COVID, the patterns and, you know, movement of folks during COVID. So they have that data, and also in linking it to HIV data. So maybe that would be a good connection for you if we connect you with the Inform project, our Inform project.
There is a connection, there is a good connection. So we want to improve these connections because I can give you an example in case of malaria issues in DRC, and all of methods is where that is implemented in DRC. So in case of malaria issues, we have a program and we have a connection with these programs. So about data science results, the program doesn't use the results from data science how to say it in English. Please, I'm sorry, I'm Frenchman. I look for how to translate for you in English. So about results that is from data science attempt, the program doesn't use it because there is a system that it judges is available for the program. So we remark that there is many issues that is not comment dire, n'est pas prise en compte dans ce travail. Cependant, the programs the programs make more how to say objections about data science. I'm sorry.
No, it's fine. You know what?
I think in French.
I don't know if there's anyone that can translate for you on the
if anyone can translate to me.
Yeah, if anyone can translate, then you know, raise your hand.
I see Kevin. Ok,
Alors,
thank you.
alors,
Thank you, Kevin.
alors.
Alors, je disais ceci. Alors, pour le programme, pour le cas de la malaria, par exemple, nous avons un problème. C'est que nous avons des résultats qui peuvent provenir ou qui proviennent comment dire, de data science, mais le programme ne sait pas les utiliser. Le programme ne sait pas prendre en compte ces résultats. Pour la simple raison qu'il y a déjà un système bien établi et il ne compte pas prendre en charge ces nouveaux types de résultats. Et quand ce que nous cherchons à savoir, à avoir de connexion avec des organisations qui peuvent nous aider dans ce sens, dans le sens de la communication avec le résultat, c'est pour nous permettre à faire des data science l'un des organes ou aussi pas l'une des étapes de décision pour le contrôle, la surveillance ainsi que l'implémentation de différents programmes de surveillance des pathogènes et ainsi de suite. Donc, c'est un peu ça l'idée.
Yeah, do you hear me, please?
Okay, you can translate, Kevin.
Kevin,
Yes,
yes,
can you hear me?
we can hear you. Are you about to ask a question?
Yeah. No, I want to translate what you just said.
Oh, okay, sure, you can do that.
Yeah. So the institution has been working on pathogens, basically virus, bacteria, and other parasites. And we want to move on to a next level. We have actually a laboratory of pathogen, which is a reference for genomic in the region of Central Africa, collaborating with the CDC. but we want to move on to a level that we can do surveillance, molecular surveillance for every pathogen that is concerning our country. And these levels require our institution to get capacity to deal with epidemiological data to help the Ministry of Health manage all the health outbreaks that can occur around the country. So the situation here, looking for the collaboration, is to build capacity that can help us to get to that level in terms of data analysis, data visualization, and data mapping in a way that we can address more of the health issues around the country.
Thanks so much.
All right, Sean. Thanks, Kevin, for that translation. Daniel, you may please go ahead.
You're welcome.
Yes, hello. Can you hear me now?
Yes, Daniel, we can hear you.
Yes. So thanks for this really opportunity of joining this team, if I can say it is a team. I really appreciate it. And I was wondering in this expectation, because me, a little more of my introductions, Daniel, I'm working on this field of data science, my master's. I'm about completing in this May. I'm working on several projects. One is related to malaria and climate change. Yeah, to see by using this machine learning about how malaria and climate change, how are they correlated, and how you understand in that kind. And I was curious about asking in these first expectations, because in your field or in your department, you would like to collaborate with data science oriented structure that would help you to strengthen the team's capacity. So in this, it seems like, how can I say? I can ask, so how and what is the procedure maybe of if I'm willing to contribute this, because DRC also is my mother country, let me say like that, even if I'm not there. Yeah, I'm outside for studying, but it's my mother country, which means I'm in right way. So can you try to help me in this, the first one, like maybe the procedure, how can I, how someone can help? Thanks.
It's very simple to contact us. You can just send to us an email, and after that, we can talk about accommodations and how we can together underline the data science issues in HNRB. It's very simple. You can just to write to me or other person that I cite on my on contact slides.
Yeah, thank you so much for that.
I have a question about Nashwan Khan. He said that he asked if there is a chance for undergraduate college students to work with PLS of the programs. I don't know if this question is for me or for anyone. Okay. I think that at INAB, you have a chance to work with us. We have just to contact us, and we can build a networking about this work. Michelle Skilton say that the okay. Okay, Michelle. The data science at INABI is very soon. And this is my first experience to work with in field of data science. And that is, comment dire, we start now to train the data scientists, but we are in the phase of recruitment of people we can handle or which are interested in data science fields.
If I may add for that question, so we are actually working on building a team for bioinformatics analysts, and at INRB, this is the actual level that we have at the institution. We don't have like a regular training every week. We're still building the capacity. The objective of that is to get different type of data analysts. It can be genomic data, it can be geographic data, it can be other type of data. And that's the purpose of getting in touch with this collaboration. We can achieve our goals.
Thanks, Kevin. I see Salako, you are unmuted. Would you like to ask a question? That's a no. All right, so we don't have our second presenter, so we do have some time if there's anybody for some more questions to Jacob. Michelle, please go ahead.
So, Rolanda, I see Emil, Dr. Emil Chimosa in the audience as well, and he's got connections in the region that Kevin and Jacob are working, and I wonder if he has some advice for them, because this is exactly his field, and training data scientists in that region. They're looking for more support around surveillance. I don't know if Emil wants to say anything.
Sorry, did you ask for advices?
Speaking to one of the audience members and asking if he would like to add to the conversation. Emil Chimosa.
Oh, sorry. Is it possible to put the question in the chat?
I don't think the
Michelle,
person, Michelle,
please,
you're
can you
asking
put
is
your question in the chat?
paying attention.
Yeah, please, Michelle.
Thanks. I put it in the chat, but maybe Emil is not hearing us. Thanks.
Oh, okay.
All right, so I think we're going to end early because our second speaker is not in the room. But are there any other burning questions from other members in the audience? Jacob? Okay, Nashwan, yes, please go ahead.
Yeah.
Could you put the contact slide one more time?
So
You
I've
say,
posted
please?
them. I've posted them here in the chat. I can just grab it for you
Okay.
again.
Thank you.
So last question maybe from my side. Jacob, what is the best way to reach you? Is it via direct emailing you directly or via the website?
I didn't hear you. What you say?
I'm asking what is the best way to contact you? Will it be directly emailing you via these contacts over here, or is it via the website?
The best way is to send me an email.
All right. All right, great. All right, thanks. Nashwan, is that a legacy
Thank you.
hand? Or do you have another question?
Thank you.
Rolanda, I'm just wondering if anyone else wants to talk about their organization while we have some time, if they link to an organization, if they want to talk about it.
Thank you. They're more than welcome to. We have about 5 minutes
Hello?
left. Yes.
Hello? Yes, sorry. Sorry. I was in a subscribed email list, but suddenly I was in a meeting. I cannot finish. I'm just joining the meeting now. I'm so sorry, and I asked to be assigned to this Baker room because I'm now leading Health Research Institute centers. I'm Luc Dogwenu coming from Benin. I'm deputy head of Tropical Infectious Disease Research Center based here at the University of Abomey Calavi. I'm also director of Regional Institute of Public Health. We call it ERSP in Benin as well. And I wanted, if probably I will have a chance to be refreshed, and then I can even have any overview of the meeting, and because I'm just noticing that you are getting to close that. Sorry about that.
No problem, Sister Laka. This is the breakout room, room 1 for health research centers. But the session has 5 minutes left. Then we will continue into other breakout rooms. So there'll be a next round where you can join any other room. However, the session will be recorded. So after today, you are still welcome to watch the recording, and then you can of course contact.
Okay, thank you.
Contact the presenters as well. Thanks.
Okay, I will record the email. I will contact them.
Right.
Rolanda, so
Yes.
Emil shared his contact in the chat if anyone wants to reach out, especially Jacob and Kevin, because Emil has he's from DRC as well, and I know he has some collaborations there. So if those folks want to connect with him, I think it would be really great. Thanks.
For sure. So the contacts are there in the chat for anybody to have a look at that. All right, so if there's nothing else, I'm gonna thank our presenter. Thanks so much, Jacob. I think it was very informative. We took a bit of advantage of your time because we had a longer session, but folks are now free to move to the main room, and thereafter we will continue with the next part of the program today. Thanks so much. Bye.
Thank you, Rolanda and Chels.